All right. Today we are going to be looking at STI, sexual transmitted infections. We'll look at some of the risks associated with them, some of the symptoms, treatments available, and also some ways that we have lessened the stigmatization of these infections over time. We'll touch base on chlamydia, gonorrhea, herpes, simplex 1, simplex 2, HIV, AIDS, human papillomavirus, HPV, and some other facets of infections. All right, so what is an STI? An STI is defined as any infection transmitted during sexual contact. Sexual contact of any form, not just coitus, which is penis to the vagina, right? Other ways too, oral, anal, etc. So the goal of the chapter is to provide accurate information about transmission, risks, symptoms, treatments without contributing to stigma. Right? So we don't want to stigmatize in our mind these infections that can happen to anybody who's engaging in sexual activities or contacts of any kind. So as long as one is engaging in any sort of sexual contact, they can be at risk for any of these infections. We'll also put up some images relating to the different infections so we have a better representation of what they are. Highest incidents seem to occur in adolescence and early adulthood. There seems to be a little bit more change in sexual behavior, late adulthood, and in your aging years. Although we do see some prevalence in what we call senior homes, a lot of transmitted diseases happening there. But for the most part, usually is high prevalence in your age group and a little bit older than your age group. All right, so looking at the type of infections, the most common ones we see out there are chlamydia, gonorrhea, and non-gonococcal hepatitis, or NGU. So we say with chlamydia, we're looking at bacteria. Right? So kind of non-viral transmission. Right? Chlamydia trachomatis, bacteria which pass through sexual contacts. Infection can spread from one body site to another via the fingers. Right? So chlamydia can happen via using the fingers. Some symptoms for women: you get inflammatory disease in the pelvis area. The menstruation is disrupted, things are thrown off. Pain within the pelvis. You see sort of fever, raised temperature, nausea, vomiting, headache. Infertility can occur, so it can impact your fertility. And ectopic pregnancy. For men, we got urethra infections, a lot of pain because of discharge and burning during urination. Epididymitis, which is essentially swelling of the testicles, where you are creating and producing sperm. So you see that, heaviness in and painful swelling at the bottom of affected testes and inflammation around the scrotum. We'll get some more information about chlamydia in a second. How about we do this? So for each one, we'll just pull up image. Let's see what chlamydia looks like. All right, so you see inflammation of the cervix. So you're looking at the vaginal opening, right? You're looking at entering the vagina, and at the top of the vagina is the cervix, right? So you're looking at the bottom of the cervix, where it meets the vagina. So you get inflammation there from the bacteria. Question? bacteria. Right? Neisseria gonorrhea bacterium is passed through penile to vaginal, oral to genital, oral to anal, and genital to anal contact. Symptoms for women: green or yellowish discharge, usually remains undetected. Inflammation of the pelvis, once again, like chlamydia. For men, we get cloudy discharge. From the penis and burning during urination, once again, just like chlamydia. Complications include painful swelling at bottom of affected testes and inflammation of blood. So very similar to chlamydia in the symptomology. For non-gonococcal urethritis, NTU, we say some of the transmission is primarily caused by various bacteria transmitted through coitus, right? Anus good, vaginal penetration. Some NGU results from allergic reactions from trichomonas infection. And some of the symptoms there for women are mild discharge plus vagina. For men, discharge from the penis and filtration during urination. Let's take a look to see what gonorrhea looks like. Alright, so we say both, these can also affect the eyes, right? It can affect the throat. Here, once again, we're looking at the cervix, so you're looking to the vaginal opening, right? Top end of the vagina and the bottom end of the cervix. So we see here, throat, homeopathic treatment for it, and some eye infections that can occur. All right, next on our list we have syphilis. Right? Syphilis is another bacterium passed from open lesions during penile, vaginal, oral to genital, or anal or genital anal contact. Right? So these are really where you have sores or lesions on your reproductive organs. Primary stage, painless chancre, right? Chancre is lesions or ulcers at the site where a bacterium enters the body. Your secondary stage, the lesion or the ulcer disappears. Generalized skin rash appears. The latent stage, right? Things may go away. There may be no physical symptoms. Tertiary stage, you can progress successfully. Al Capone, I believe, died from syphilis. Right? I think engaging in sex with prostitutes. Right? So heart failure, blindness, mental disturbance. For Capone, I believe that he had mental disturbance in the tertiary stage, and even more. So death may result from syphilis. Let's take a look at syphilis. And here's a little bit of the symptoms of syphilis. That one, I think, supposed to be penis. You can get lesions all over the chest area, arms, back, neck, even the hands. All right, next is herpes. All right, herpes is broken up into two different viruses, right? HSV1 and 2. Let's start with 1, oral herpes, right? Passed by kissing or oral to genital contact. So the skin-to-skin contact is necessary for the transmission of herpes simplex 1. And for 2, genital herpes passed primarily through penile-vaginal, oral to genital, oral to anal, or genital to anal contact. We're looking at small, painful, red bumps appear in the genital region or mouth. Bumps become more painful blisters and eventually rupture to form wet, open sores. And herpes is pretty prevalent. Let's take a look what herpes is. Alright, so herpes simplex virus 1, right? So that one's primarily going to be on the mouth and also affect the eyes and some rare conditions. So you will see blisters forming on the mouth. Eventually they'll be extremely painful. They will begin to burst and they'll become very white. Essentially they become sores. Let's take a look at herpes simplex virus 2. Well, 2 primarily is the diagram over there for the genitals. So you get sort of a cluster of these red bumps, right? They become a little bit white and plus in the middle. They become inflamed. They also can move to other parts of the body as well. So that's what that's in the hands. That was described as extragenital herpes. All right, then we got HPV, human papillomavirus. HPV is passed primarily through penile-vaginal, oral to genital, oral to anal, or genital to anal contact. This one can cause genital warts. So usually if you hear someone describe something as genital warts, primarily they're talking about HPV, right? Which are hard, yellow-gray growth on dry skin areas, or soft, pinkish red and cauliflower-like growth on moist areas. Can also cause cervical cancer as well as mouth and throat cancer. So HPV can also be a deadly virus. Let's take a look what HPV is. Bumps all over the body, sometimes within the mouth, on the inside of the mouth. But essentially, the bumps can form anywhere. A lot of times on the genitals, sometimes in the throat area, sometimes on the knees. Alright, so before we get into HIV and all of the rest, we'll do a discussion question. Let's see. This one's not going to go up on the board because the mouse is kind of acting up, but I'll tell you the discussion question. Should people with STIs always tell their partners? What if they're reasonably sure that they are not that infectious? What responsibility do people have, STIs have to their partners? How about to their ex-partners? So a few questions there, right? Should people always disclose, even if they feel that they're not infectious, right? That they're not able to pass it? Should they disclose to their ex-partners, at some point? And the other part was, what responsibility do people who have STIs have to their partners? So discuss. And think of, are there any instances you could think of where you don't disclose? Also, do you think, here's another one, do you think people on dating apps should disclose that as part of their sort of description? Think of if you get tested and you recently had someone you broke up with. Would you have to reach back out? And if so, how far would you reach back out? Because you probably have no clue as to when the testimony, not have a clue as to when you actually contracted the virus.
kidney.
Yeah. But like, which one is the worst scenario? Which one would you rather be in?
Is the infection curable?
Let's say it's,
All right.
let's say it's gonorrhea.
Real question, what would you do?
Wake up without a kidney, nice bath, or not wake up with an STD.
I mean, if the STI is not permanent, take that. Right? Take some medication.
So you'd rather have an STI and then keep your kidneys.
But if it's something permanent, no, maybe give up the kidney.
Yeah,
I
it's
think
like-
one kidney.
No kidneys, only one kidney or AIDS.
You can always get a transplant. Right?
Yeah.
All right. What do you guys think? What are some of your thoughts on this? Should you always disclose? Is there times where you don't need to disclose? Always, under no circumstance. How far back would you reach out in terms of if you got tested? Quite recently, and were engaging in promiscuous sex. Yeah. What about expressing it on dating apps? You feel that should be out there, or you gotta wait till you get to know people before you disclose it?
I mean, if you were on a dating app, you probably meet someone first, you have to meet each other, and if you have a problem, then
So maybe disclose at the meeting. All right. No.
We agree.
Yeah,
Missing a couple breaks. We don't think that it needs to be disclosed on a dating app unless obviously it's a dating app for people who have STDs or STIs, whatever the case may be. Because unless the person's like really shallow and selfish and they're like, oh, you just wasted my time, you should put this on the dating app, we probably shouldn't be meeting with them anyways. So, just move on to the next after that. So that's something that should be disclosed after we meet with them. And we also said that we should go all the way back to like first encounter, first intercourse that you have with someone, just so that they know like what's going on. Because people should be getting tested regularly anyways, but in case they aren't, like just put them in a know so that we don't start an epidemic. And then what was the other one?
Yeah, that's
There's a lot of different ones.
Yeah.
Yeah.
That's good enough. What do you think?
Similar to the Coco Canoas, we kind of were discussing that maybe if you're just in the talking phase and you don't know that you want to pursue something serious or have like relationships with them, then probably shouldn't disclose it. And then when it starts getting if it starts leading somewhere, that's when you start like informing them about the disease. We also said that it probably shouldn't be on the dating site because it does seem something personal. And even like if someone was just swiping up, I don't think that's information for them to know.
So it's medical information, right?
Yeah.
We should be giving out
Violations.
medical information. What do you?
I honestly feel like it depends on like the type of relationship you have with your partner. Like you said, if you're kind of in the talking phase, like maybe that's not something to disclose upfront. But if you guys are starting to get serious and like are starting to get into a sexual type of relationship, then yeah, that would definitely be the time where it's like, hey, this is what I have, this is what we have to kind of maneuver around because of it. And I think on dating apps too, there are some dating apps that like have specific options for users who like it'll like list the type of sexual disease that you have and then you can either put that in your bio or something like that or you can say like you're good. And it's I feel like there it's still pretty personal and it's like when you meet someone you won't be like, hi, I have HIV or something like that.
Yeah.
So it'll just be kinda awkward.
Yeah.
So it's kind of like on the dating app, I feel like it's not really anyone's business until you really get to know them.
Gotcha. Hey, do you think that can cause issues between either party, meaning that if you do take time to get the know someone, now you disclose and they completely ghost you or get rid of you, now you might face your own trauma. Or, you know, they may say, hey, why you don't let me know out the gate? Hey, why you don't let me know before we even met? So that could be a little bit traumatic for them. You think those issues can arise?
I definitely think they can arise, but if you care for someone enough, then you're willing to go through certain obstacles in order to stay with them or be with them or whatever the case may be. Because there are ways to still engage in intercourse safely without contracting diseases from the other person. And like medical stuff has like improved so much over the years to where like HIV, you're not dying within 2 years anymore. So, I mean, it can be traumatic if you let it. You know what I mean? Like there's ways to be around it, to get around it.
Alright, moving along, we got viral hepatitis. Hepatitis can be spread from fecal matter and through blood. Right? So it's passed through in semen as well too. We have semen, vaginal secretions, also saliva. Manual oral or penile contact with anus is strongly associated with hepatitis B because of the fecal matter. Hepatitis C is spread through intravenous drug use and less frequently through contaminated blood products, sexual contact, or mother to fetus, mother to fetus. So you can also get hepatitis through food, right? Exposure to blood and food. Or someone cutting their hand and prepping the food, fecal matter being spread onto food, things like that. So it varies from no symptoms to mild flu-like symptoms to incapacitating illness characterized by high fever, vomiting, severe abdominal pain. And next we got bacterial vaginosis, which is microorganisms passed through coitus. Fishy or musky smelling, light gray, thin discharge, consistency of flour paste. Men usually are asymptomatic from it. Right? Usually women experience it from either semen or bacteria on the penis, maybe a sex toy, fingers, something of the sort. Yeast infection, right? Candidiasis. The fungus Candida albicans accelerates growth when normal chemical balance of the vagina is disturbed. It can be passed through sexual interaction. You see the pH balance thrown off. For women, white, cheesy discharge, irritation of vaginal and vulvar tissues. Men usually asymptomatic but may have itching or reddening of the penis and burning during urination. Then we got trichomoniasis. This is a parasite, right? Usually passed through sexual contact. For women, that's white or yellow vaginal discharge with unpleasant odor. The vulva is sore and irritated. Then once again, also usually asymptomatic, but may have urethral discharge, urge to urinate frequently, or painful urination. And then we have crabs, right? Or pubic lice. Pubic lice is spread from body contact or through shared clothing or bedding. Right? You can get crabs just by sleeping in someone's bed or sharing their clothes. Crabs, public lice, persistent itching, lice are visible and can be located in pubic or other body area. Let's see if we can pull up. Let's see if we can pull up crabs. Alright, so here's the images for crabs, for pubic lice. they have different species, but yeah. This would be the genital areas under a microscope. Here you can see, you could probably see it on your finger, you could find it. But this is what it would look like with the genital area.
It's our actual
Alright. Scabies. Anyone ever knew anyone who had had scabies before? Right? Scabies, highly contagious. Small bumps and red rash that itch intensely. Scabies lives underneath the skin. So you won't even see the parasites topping. They're really burrowing underneath your skin and creating these lines that are highly, very itchy.
I thought that was the thing that pirates got, but that's scared me.
It's
Could this be passed by close physical contact, sexual and non-sexual? So even toilets, right? So going to, using public toilets, you can catch scabies. So just kind of cover the toilet seat. Even clothes, things like that. Small bumps, red rash, that itch intensely, especially at night. They tend to be more active at night. Alright, next we got HIV, human immunodeficiency virus. And we have AIDS, acquired immunodeficiency syndrome. HIV is passed through blood, semen, vaginal fluids. Right? Attack the immune system, T4 cells as we call it. Right? The T4 cells are used for your immune response. Tell your body how to respond with the immune system. Passed primarily through penile-vaginal, oral to genital, oral to anal, genital-anal contact, or by needle sharing among blushing injection drug users. Alright, symptoms. Varies with the type of opportunistic infections or cancers that can afflict the infected person. Common symptoms: fever, night sweats, weight loss, chronic fatigue, swollen lymph nodes. Right? Those T4 cells are reactive to lymph node sites, right? To activate your immune response. Diarrhea and or bloody stool, atypical bruising or bleeding, skin rashes, headache, chronic cough, and a whitish coating on the tongue or throat. I think we have some stats on HIV. Let's see. Alright, so HIV, 40,000 new cases in the United States and 1.8 million new cases globally each year. And more than 36 million people worldwide living with HIV. Rates rising amongst teenagers, women, minorities, particularly young men who have sex within the United States. Heterosexual contact has always been a primary form of transmission around the world. Most highest though in homosexual activities, men, male on male, or male on female, and even heterosexual male on female. Usually highest with male on male. What do they call it? This receptive. So usually if you're the person receiving anal sex, you are putting yourself 13 times more at risk for contracting HIV because the rectum has a very thin lining, and blood and semen can easily get into your bloodstream that way. Right? So if you are the receiver anally engaging in sex, you're 13 times higher at risk. than if you're together. What we call inserted. So bottoming or topping as we described. Lesbians tend to be very small in terms of HIV. Usually it's from drug intravenous use. Very rarely, only a handful of cases where someone has passed it through sex toys, fingers, mouth, tongue, etc., etc. And female to female. All right. Yeah, another discussion question. All right, here's one. Does the government have the right to inform partners of people with STIs about their status? What about life-threatening STIs or STIs that can compromise future fertility? Does the government have the right to inform people, say if it has information that some people have HIV?
Like a list, like a info list kind of, or can you just find it on the internet?
Should the government be able to inform people who has life-threatening diseases, and, STIs? Right, and here's another one. Should a person who did not, who knew their status and did not tell their partner, should they, and that partner caught it and potentially die, should they face some sort of prison time?
I feel like they also have a right to know as well.
You can tell your partner that they died from it. It's not
All right, what are some of your thoughts? What do you think?
We said no, because like a thing, and it's like different since it's like medical information being published, rather than like a pedophile, so it's like for safety and so forth, but it doesn't like, it's nothing medical related.
So it makes a difference?
I feel like, why is it a thing that, you know what I mean, like I couldn't just go to your doctor and ask if you have an STI, they wouldn't tell me,
How do you feel?
I don't have to know. It's published.
Should be. For things like this, say HIV, AIDS, things incurable. Because we say with viruses, they're incurable.
Right.
Viruses are incurable. They can be managed with medication, therapies. Okay. What do you think?
So I think one of the biggest things is, that type of information, putting it out, is very easily abused and manipulated for things. Because if you were trying to get a job and your name's on a list for something like HIV and AIDS, then, your employer can see that they might not hire you because of that, because it's not just that you have it, but they think it might be a reflection of the type of person you are. Of like, oh, since gay men are more likely to have AIDS, like, oh, you're probably gay, you're probably promiscuous, and we don't want you. It's like, it's another way to shun people from certain areas when that information is made public. And since these are so life-threatening and having all that information, there's a lot of probably insurance fraud that you can do with that too. If you're like, do you know if people are going to die soon? Like, it's just something that can be
It will be abused.
used against you, yeah.
All right.
So do you agree that there shouldn't be a list for it, just as the stigma around it will grow, people are gonna try to avoid you, and like, it's been said, like, people who are looking for jobs, people can look it up, and say like, look at what I found. It should be enough that the person should be responsible for informing their partner, and if they don't, then I think there should be some legal consequences about that, because at that point, you're putting that person at risk, like threatening risk, and it shouldn't be taken lightly.
I definitely feel like it shouldn't be like on a list because that's something like extremely personal, and for someone to take that away from you and then like also potentially paint you as this type of person that like sneaking around and everything, and that's the reason that you might have it instead of like glad I was doing something completely different to that. I feel like that's just really wrong, and it's kind of invasive as well, because what is the real purpose of doing that? Are you doing it to like protect the collective, or are you doing it because like this person, kind of like what you said, like you're dying soon, like is there like what's the motive behind it?
Yeah, and we know certain groups are more affected than others, right? I think we have, okay, we'll look at this one, but we'll see HIV across the globe. So people living with HIV, here we say millions of people, around maybe 37 million. Those who are actually aware of their status are about only 75%. Those who are on treatment, close to 60%. And viral load suppression. With HIV, viral load is a major thing. Someone may have a small viral load, meaning that they're not really able to pass it on as easily, even if they were having unprotected sex. While someone may have a high viral load, right? And they can easily pass it on to someone else. And it also may be affecting their own antibodies a certain way. Correct. remember, viruses are incurable, whereas bacteria is used with antibiotics. Okay? So we'll look at some of the treatments. Alright, so for gonorrhea, so we already covered gonorrhea, but let's see the treatment, right? There's some more complications for men, prostate abscesses, painful bowel movements, difficult urination, possible sterility, right? So it can affect men to the point where they can't produce children. Some of the treatment cured with antibiotics, right? If you ever catch gonorrhea, go to the doctor, give you some medications. You should be able to do it. Right? We said with NGU, treatment can also be cured with antibiotics, but you gotta make sure you take care of that one because you get that inflamed cervix, prostate, endometritis for both, and then penile discharge, urinary burning, syphilis. I think they had a good another illustration of syphilis. Syphilis can impact even the soles of your feet and the palms of your hand. Syphilis also cured with antibiotics. Alright, for herpes, antiviral medications, the same would be with HIV, but here we say with herpes you have increased HIV and ocular herpes risk. Ocular means the eyes, so you can have herpes on the eyes, as we saw those bumps and rashes, right? Also some complications, we say cancer of the cervix can form, and you can infect your newborn with herpes. HPV. Treatment, you can remove the warts, right? And there's some also vaccines as well too to prevent this. Public lice, crabs, over-the-counter medications, a lot of topical things, right? Scabies, topical scabicide. There it goes. There's some common myths that people may not know. HIV is not transmitted by saliva, sweat, tears, hugging, touching, kissing, and sharing toilets. Likelihood depends on viral load, greatest when transmitted directly to blood, right? Which is why the anal sex is look more riskier than other forms of sex. There was an issue with Magic Johnson, right? When Magic Johnson first was diagnosed with HIV, a lot of basketball players did not want to play with him. They were very vocal about it because they were unaware of how it was transmitted. Right? So when people like Karl Malone, I think was very vocal. He didn't want to play basketball with Magic Johnson, thinking that he could catch it with like sweat or Magic, getting like a cut on the floor, touching him with the blood or something. All right, development of age, usual progression ranges from 8 to 11 years. Right? Let's take a look at what that looks like. Right, before that. No cure currently exists to treat HIV. Instead, you'll be on antiretroviral therapy, right? Shows best results with one progress, combination drug therapy, to the point where it's undetectable or untransmittable. They say that viral load, they may get to a point with the medication and treatment to where you can't even detect it in a blood sample, right? It may not be transmittable. I think that's for Magic Johnson, that's his case too. There's also drug therapy to prevent mother-to-child transmission of HIV. Still a search for a vaccine. Let's hope is just keep working on it long term. All right, so what's the best prevention? Use latex condoms, bless you. Reduce number of sex partners. Avoid oral, vaginal, or anal contact with semen. Avoid oral contact with vaginal and anal fluids. Be tested for HIV regularly. Take pre-existing prophylaxis, PrEP, if you are at high risk, with living with HIV, take advanced hyperactive retroviral therapy. Right, some things are curable, others not. That's what we kind of learned. Can compromise health, cause pain, discomfort, infertility, and even death if not treated. We all have a role to play in understanding STIs and reducing STI stigma. But let's get that last sort of visual. Alright, so this individual's living with AIDS. Alright, and what has happened here is there tends to be lesions formed all over the body from the lack of immune response, gets to the skin, and progressively worse. Usually once it gets to AIDS, high degree of likelihood of death and disappearance. All right, that's it for today. We'll wrap it up, and I will see you